Hi, I'm Karen Wary. I'm the Manager of Clinical Excellence. I'm here today to talk to you about Ventrogluteal and the Ventrogluteal injection. Why use a Ventrogluteal? We have discovered that using the Ventrogluteal site is less painful for our patients. It's easier for our clinical staff to find the site, and there's a great muscle there that we can use to dispense the medication into. It's safe. There's no large blood vessels, no nerves located in this area. I'm not going to injure someone, and most likely the patient will feel very little pain when I give the injection. So how do we find the Ventrogluteal injection? First thing you're going to do is ask your patient to show you their hip bone, and they're most likely going to show you up front here, and this is called the iliac and the iliac crest. You're going to follow that iliac crest up to the very crest, to the top of it. This bone has 1 inch to 1.5 inches of muscle that covers it. You're going to take the heel of your hand and place it on the greater trochanter and stretch your fingers out. Make sure your thumb is always pointing towards the groin. If your thumb is not pointing towards the groin, you're going to make a mistake. You're going to be in the wrong area. So your thumb is pointing towards the groin, the heel of your hand is on the greater trochanter, you have stretched your fingers out and you're feeling for this iliac crest at the top. Take the hub of your needle and you're going to place it at the bottom of the V. And this is where you think your injection is going to go. If you take your hand away, you're going to make sure that you're halfway from where your injection should go to the iliac, and you're going to make sure you're halfway to the greater trochanter. You want to be perfectly in the middle and lined up in a straight line. And when you're holding your hub of your needle on the skin, you're going to make an indentation. And the indentation will last for 3 to 5 minutes. So I've marked where I'm at. I'm in a perfectly straight line with the femur here. It's straight up and down, so I know where I'm going to give the injection. Everything else stays the same. You're going to wear your gloves. You're going to cleanse the area, start in the middle, 2 inches out. With your left hand, hold your area, and you're going to give your injection and aspirate. You have 1 inch to 1.5 inches of muscle here. So if you hit the bone, don't be alarmed. All you're going to do is pull it back just a scooch. You're going to aspirate and give the injection. You don't hurt the patient hitting the bone. You want your patient to be lying down. You want to be standing in front of your patient. And with your patient lying down, they're going to be lying on their left side with their right side up. And this will make the greater trochanter really stand up for you and make it easier for you to locate it. You're going to put the heel of your hand on that greater trochanter and again ask your patient to show you their hip bone and find your placement as we've shown you. If you have a very large patient, an obese patient, they're very difficult and you're going to have to take your time. What you're going to want to do is have that patient move that top leg up and down, back and forth towards their chest until you can locate that greater trochanter moving underneath the tissue. And then have your patient straighten his leg out. If the leg is not straight, you're going to have difficulty finding your orientation. So make sure the top leg, the right leg, is straight, and then you can locate your site. A few more things I'd like to mention about this Ventrogluteal site is that you can still give 2 cc's of medication into this site. There are no vaccines that can go into this site. Vaccines go into the deltoid and into the vastus lateralis, so read your manufacturer's inserts. If you have any problems, any complications, please contact me. You can reach me at Karen Wary, W-H-A-R-R-Y. I'm located in Outlook. I'm the only Wary there, so please let me know. And let me know how you do with this, if you have what your patients say.